Options for keeping your baby safe during labour. During labour, one of the most important things we do is monitor your baby's heartbeat to make sure that baby is safe during the process of birth. There are two main ways we can do this. If you're giving birth either at home or a midwifery-led unit, then the midwife will listen in to baby's heartbeat regularly using either a Doppler, which is a small electronic piece of equipment, or a Pinard stethoscope, which looks a little bit like a trumpet and sits on your tummy. They will listen in to baby's heartbeat regularly. This is called intermittent auscultation, or IA for short. The other way of monitoring the baby, and this usually happens when you're giving birth in a hospital setting, is using electronic fetal monitoring, or using a cardiotocograph, or CTG for short. This measures changes in baby's heart rate over time and looks at changes in relation to the contractions. It uses the patterns of these to indicate whether the baby is coping well with labour or not. We look for that heart rate looking nice and wiggly, and it's also normal to see increases in the baby's heart rate regularly. There's something called accelerations. Just occasionally, it's really difficult to get a good signal with the CTG, and therefore you might be offered something called a fetal scalp electrode, which is a small clip that sits on the baby's head. It's completely safe, but enables us to get a much better reading of the baby's heart rate pattern. Whichever type of monitoring you have, the goal is always to keep you and your baby safe during pregnancy. And if you've got any questions at all, you should always check and ask with the midwife or doctor looking after you.